So I'm a genitourinary medical oncologist, and so I think, in general, the takeaway from our field of kidney cancer, bladder cancer, urinary tract cancers, especially, is that there have been tremendous advances in immunotherapy for these diseases over the past 3 to 5 years. And really, if you think about how cancer therapies have changed as a whole over the past several decades, this is a really fast pace of change, and it's really good that we have all these new therapies available for patients with advanced cancers. And I think looking forward, it's also an exciting time, not only because we can potentially build on these combinations and try to improve the outcomes from what we've already achieved, but also trying to move these immunotherapies maybe even into earlier stages of disease, where right now we're using them only in advanced or metastatic disease, but trying to move them into sort of higher risk localized disease where there may be a higher chance that the cancer may ultimately come back, and hopefully immunotherapies would decrease that chance significantly. So I think building on what I just mentioned with regards to all the advances that we've had over the past 3 or 5 years, those changes came about as a result of clinical trials where patients were willing to donate their time and their bodies and try to get a chance at a better therapy, both for themselves and for other patients in the future. And I think that is a very important issue within oncology, to be able to properly ask these questions and to be able to find the next best treatment for our patients. So again, there's been a lot of advances in the field over the past 3 or 5 years. It's exciting times, and I think what I talk about with kidney cancer is 3 new therapies, immunotherapies over the past year or so, and hopefully those changes will continue to come in the next 3 to 5 years. So I think we're in a really unique and special cancer institute with dedicated clinicians, oncologists who see patients and treat patients, as well as oncologists who are involved in clinical trials and in research trying to find the next best therapy. We also have a lot of laboratory-based collaborators who are really world-class at what they do, and help in thinking about the molecular mechanisms behind why certain therapies work for certain patients and why certain therapies may not work for other patients, and trying to figure out new targets, new drugs that may benefit patients down the road.